Understanding special needs. The difference between disability, disorder, and difficulty. Words matter. Clarity empowers. Too often I hear the terms disability, disorder, and difficulty used interchangeably. But as a special educator, I know this confusion creates misunderstanding, and misunderstanding creates misjudgment. So today, let's get it right. 1. Disability, a limitation in functioning. A disability is a long-term condition that significantly impacts a person's ability to carry out everyday activities. Examples: visual impairment, blindness, hearing loss, cerebral palsy. Intellectual disabilities. Disabilities may be physical, sensory, intellectual, developmental, emotional, or mental. They often require environmental adjustments, assistive technology, and societal inclusion. 2. Disorder, a disruption in normal functioning. A disorder refers to a diagnosable condition that disturbs normal physical or mental functioning. Examples: autism spectrum disorder, ASD, attention deficit hyperactivity disorder, ADHD, anxiety disorder. Oppositional defiant disorder, ODD. A disorder may not always result in a disability, but it can affect learning, behavior, and social skills. 3. Difficulty, a challenge in a specific area. A difficulty is usually less severe and may be overcome with support, training, or time. Examples: reading difficulty, not necessarily dyslexia, difficulty adjusting to new environments. Temporary speech delay. Concentration issues from trauma or stress. It may be situational or developmental and does not always require a medical diagnosis. Why this distinction matters? Imagine this. A child struggling to read may be facing a learning difficulty, for example, lack of exposure, living with a learning disorder, for example, dyslexia, experiencing a learning disability, for example, intellectual disability. The intervention differs in each case. Mislabeling can either overdiagnose or ignore the child's actual need. The danger of confusion. When we use disorder instead of difficulty. When we say disabled without clarity. We unintentionally stigmatize the individual. Delay appropriate support. Confuse teachers, families, and caregivers. Fuel unnecessary fear or pity. Call to action. Be precise with your words. Ask before assuming. Listen to professionals and lived experiences. Advocate for accurate diagnosis, not quick labels. Let's shift the narrative from careless talk to conscious terminology. Which of these terms have you misused or misunderstood before? Let's unlearn together.